For more, we can speak to our international affairs editor, Philip Turle. Philip, hello to you. Tell us more about what the WHO is saying.
Right, well, basically, William, what they're saying is that if Europe does nothing, then we're staring at possibly another 500,000 deaths from COVID over the next 3 months until February. And there are three main reasons for this, according to the World Health Organization. The first one is that not enough people are being vaccinated. Second reason is there is a lifting of protective measures and people are not wearing masks as they should. And the third one is there's not enough fresh air circulating in closed rooms. And if you look at these figures here, you can see how bad the situation is over the past week. A 57% increase in the Czech Republic, 53% in Austria, 38% in Germany, 37% in Poland, and 35% in the Netherlands. So there is a massive increase, and that means that Europe is now back as the epicenter of the COVID outbreak. And that means more hospitalizations. They have doubled over the past week. New cases increasing on a daily basis for the past 6 weeks. The European average now is 250,000 daily cases and 3,600 daily deaths. That's another big increase. So there is pressure on the authorities around Europe to take drastic measures to try to stem that flow. They say, for example, if people were to wear masks in closed spaces inside buildings, that could bring down the threat of COVID deaths by 95% by the month of February.
Philip, since the pandemic began, it sort of revealed inequality between rich and poor nations where fewer people are vaccinated. What is the international community doing?
So that is another huge problem that is still staring us right in the face, those of us who live in the developed world, because it may be okay here with 60% of people on average in the developed world who are vaccinated now. But if you look further south, for example, to Africa and other countries, then you find there's only 3%. For example, here in France, 76% of people have had one dose and 68% have had 2 doses of the COVID vaccine. If you look at some African countries and other countries in other poorer nations, that figure goes down to only 3%. So there is pressure on the developing world to get those vaccines down there. There are 2 ways of doing this. This is one of the hotly discussed subjects at the G20 summit where I was last weekend in Rome. The first one is for the World Bank to send out that $100 billion that they have pledged to help fight against COVID, help countries get those vaccines in so that they can inject people as fast as possible. And the second one is for the COVAX vaccine system to come into effect. What is COVAX? Well, COVAX is the global COVID-19 vaccines access organization, which is basically taking all the excess vaccines from countries around the world and sending them to the developed world where they can then be used to vaccinate people. They aim to deliver over the next few months up to 1.3 billion doses to 92 of the world's poorest nations. But there is still an awful lot of work to be done. And the problem here, William, is twofold. First of all, that if those vaccines are not given out, then more people are going to become infected and more people are going to die of coronavirus. That I think everybody can understand. The second big risk, and that's a risk for everybody around the world, not only those in poorer nations and in the developing world, is that if the sufficient steps are not taken to try to stamp out the coronavirus, then we could be looking at a new variant coming along, a new variant that could be resistant to the vaccines that are currently on the market. And if a new variant does come along that is resistant to vaccines that are currently on the market, that could bounce back in the face of all those who've already been vaccinated, and they will become vulnerable all over again, and we could be facing more confinement and more misery. So that's why there is so much pressure on everybody to get these vaccines out of everybody who can get vaccinated, to get vaccinated as quickly as possible.
All right. Thank you very much, Philip. Philip Turle, our international affairs editor.